Hi, this is the first of a series of video segments that will look at the muscles of the cervical region. This first segment is going to look at the arrangement of those muscles into different groups. There are three groups of cervical muscles that I want you to be thinking about because they act on different joints in the cervical spine. The first group will take their origin from the trunk and attach onto the cervical vertebrae. So they'll be moving the lower cervical spine. The second group attach from cervical vertebrae up to the skull, and so they'll only be acting on the upper cervical joints, and there are two specific joints we'll look at in more detail shortly. And the third group attach from the trunk all the way up to the skull, and therefore they'll act on both the lower and the upper cervical spine. So the neck on trunk muscles are crossing the joints of the lower cervical spine, which we know are somewhat mobile but have their movement limited by intervertebral discs. In contrast, the head on neck muscles will be acting on the joints of the upper cervical spine. The first of the joints of the upper cervical spine is between C2 and C1. The atlantoaxial joint allows us to produce a large range of rotation in the horizontal plane because it's a purely synovial joint. The other joint of the upper cervical spine is between C1 in my right hand and the skull in my left hand. The atlanto-occipital joint allows extension and flexion in the sagittal plane. Again, large range of movement because it's a synovial joint. This model gives us an example of some of those muscle groups we've just been talking about. So we're looking at the posterior view of cervical spine and upper thoracic spine and the base of the skull. We can see here muscles originating from ribs, that is the trunk, and inserting onto the cervical vertebrae. So they're crossing the lower cervical spine. In contrast, we can see a group of muscles here originating from the cervical vertebrae and inserting onto the skull, so they're crossing only the upper cervical joints. And you could envisage a third group that would originate on the trunk and attach up onto the skull and therefore would cross all of the cervical joints. You've looked at a series of video clips that have outlined the division of the cervical muscles into these three different groups, and thinking about those groups in terms of which joints they're crossing and therefore which joints those muscles might act on. I now want to get you to assess your understanding of that information. So if we looked at each of these different groups, we're saying the neck on trunk muscles originate from the trunk, could be various bony landmarks, and insert onto the cervical vertebrae. And I'm going to ask you to tell me which joints those muscles would act on. The second group, head on neck, originate from cervical vertebrae and attach onto the skull. Which joints do they act on? And thirdly, the muscles that run all the way from the trunk to the skull, which joints do they act on? You can pause the video now while you complete that task. Having seen those video clips, hopefully this was a relatively straightforward task. The first group of muscles originating from the trunk and inserting on the cervical vertebrae, of course, acted on the lower cervical spine, and these are typical intervertebral joints where, whilst the cervical region is relatively mobile, the mobility is limited by the presence of intervertebral discs. The second group, the relatively short head on neck muscles, originate from cervical vertebrae and insert onto the skull. So they're crossing the upper cervical joints, and by upper cervical I'm referring to those two specific joints that we looked at, the atlanto-occipital and atlantoaxial. Both purely synovial joints, so they therefore have a relatively large range of movement and in particular planes for each of those joints. The third group, the head and neck on trunk muscles, of course originate from the trunk and insert on the skull, so they're crossing both upper and lower cervical spine, so we need to consider potential movements at each of those regions. We're now going to look at a series of video clips that will cover the specific muscles in each of those groups in more detail.